I am Chester Dunham, and this is the Dunham Report, a marketplace of ideas and information for labor, civil rights, and other issues of social justice. I am Dunham, and I'm the host of the show, and my co-host is Mr. Wesley Crenshaw. Mr. Crenshaw.
Yes, Mr. Dunham.
How are you doing tonight, sir?
I'm doing quite well now that my team is in the Super Bowl.
All right, well, do me one favor since you're doing well and this and that. We got a good show for you, the viewing audience, tonight. Very informational show, and especially for senior citizens, because what the show is about tonight is for a lot of help and valuable information that you will receive from listening and looking at this show tonight. Wes, would you introduce our two guests tonight and starting out, and then we'll go from there?
Well, we have two people with us tonight, at least three, but we have two right now. One is Miss Olive, which I've grown to know for a while, and the other is Miss Marybelle. So I'd like for most of you to tell us exactly what you do and a little bit about you, where you're from. You can start, you, Miss Olive.
I am Olive Hillery. I'm a native of McIntosh County. I am a retired food service provider, and I am a senior that advocates for seniors.
And what church do you belong to? What's your pastor? So if you say anything wrong, he can call us up.
I am a member of the St. Louis Baptist Church, Sapelo Island, Georgia. We are without a pastor, but we're looking for one.
You said St. Louis on Sapelo?
Mm-hmm, on Sapelo.
Did you know the Johnsons?
I know all of them.
Okay, they're a member of my church. Mrs. Marybelle?
Hi, my name is Marybelle Holston, and I'm a native of McIntosh County, born, reared, and raised. And I am a senior citizen at the McIntosh County Senior Center, where I worked for 15 years as center manager. Now I'm retired.
So what kind of program you guys want to introduce us to or make us aware of?
Well, the programs we advocate for are funding for in-home care for seniors. We advocate for transportation for seniors. So there are many things that that we are going out and advocating for, and like I said, advocating for the aging Georgian and their families was started in 1977. That's when Co-Age started.
Is this an organization where you guys are seeking funding to help lower income people with income in home service?
That's what the Co-Age is all about. Helping seniors.
Back again, for you, the viewing audience, I want to make sure we do this show right, start off right, do it right. Everything else for you, the viewing audience, could get all the information that you need. Now, what we're going to do is that the first thing, because some of the question that was asked just a few minutes ago, we're going to go back into those questions. And we're going to bring it all out, these ladies, where you, the viewing audience, can make sure that you understand exactly what the organization is about. Number one, I was looking at where Governor Deal signed the Family Care Act, and what it was to reduce the burden of family caregiver. Now, the name of it is Co-Age. And it's so many different things that's involved in this. So first I want to ask the question that, looking at that, and this happened in Georgia, the state of Georgia, Governor Deal and the representative signed into law. They agreed. And after they agreed, Governor Deal signed the act, which is the Family Care Act. That's really what it is, to help reduce. And that's what we're talking about, helping seniors, and we're going to get into all of this situation. Let's go to the number one is that Georgia Senior and the population of senior. And now, as we know, it is expanding. In other words, instead of reducing, it is growing.
Yes.
So it's a plus instead of negative. So what any person or individual who may have relatives, and we all have relatives, and that need this care right now, what we're talking about. So let's say, for instance, if I have somebody or Crenshaw or either know people that in need of this service now, can you tell me or tell us who it is, other words, who is qualified to receive it, and how they can get help, who they can go to, and all of this. So, and the first thing is, number one is to a person who need this care, how they can get assistance and who will qualify for it.
Okay,
Any one of y'all who might want to answer that.
There is Coastal Commission.
Community.
No, not
CDRC.
that. CR Coastal Regional Commission in Darien out on Highway 251. That's the agency for them to contact in order to get help. These are the issues. We have several issues that we will be going to the Capitol to advocate for this year in February. And anyone that's seeking help, like with someone with Alzheimer's, needed things in the homes, there is a layout of everything at that center. They could go and look at, they could purchase stuff for use in their homes, like they'll get their bath, their lift chairs, their cushions you could buy to push yourself up. There's quite a few things that you could purchase at that center.
Okay, you mentioned Darien. I want the viewing audience to understand that we are talking about a project that will affect everybody in the state of Georgia. So if you have a center or location in Darien, I'm quite sure you do have.
Yes.
But it is other centers and things around the state. Let's see if we cannot, even with this material, and there's a lot of stuff here, maybe a key number that people can call, not if they just live in McIntosh County or in that area, but that they can reach out and call this particular number, because when we get through, we want to make sure that they will be able to go to a particular number or get the type of information that they need so far is to get this particular help that the governor signed into law.
Yes,
And so let's just say we just use Darien for a headquarters in this area. These ladies here is from McIntosh County.
Right.
But we're going to be talking about the state. Now, they're talking about that area down there, but we want to make sure that we want to ask the question to them, one of them, and she just explained a few things just now, that what they are able to purchase at this particular location, which is in Darien. And then we want to make sure that we will get the other information for you, and we will follow up on this on other shows to make sure that you will be able to call the show or call a number, and we'll make sure that we steer you in the right direction. But what again, I'm coming back to, is some things you can buy, but it's some things that the state provide for people.
Yes.
And let's go back and try to talk about what the state and the representative in the state sign into law, because I don't want them signing no particular law or bill that is going to cost you still, and it ain't going to help. So this is where we want to try to figure out what they provide right in this area here, or when you go to purchase something. Some of the things you named a few minutes ago, some of those things are provided by the state, and it should be. If not, we need to do more with this particular bill or law, because everybody who lives in Georgia sign on to this particular bill. And people can go to their representative. You look at the bill itself and go to their representatives and say, look, what about this or that? And if the bill is still not even good enough, we can push and make sure that it become a better, more meaningful bill that will help people even more. And that's another thing that people got to understand. Just because somebody represents me and we vote for them here and there, and they jump up and down and say, well, we pass a bill, and you come to find out that you're paying a lot of money. No, we're got to do more than that. And so this is where we want to kind of hash out a little bit as we continue on the show.
Let me go back.
You could come back and see what all that you all can put your hand on, that what it actually does, free of charge.
Well, let me go back a little bit.
Okay.
Georgia Council on Aging is the branch that we sit under as seniors, advocating for seniors.
Okay.
There's a group of individuals comes together.
Okay.
Like, for instance, these 5 items that we'll be advocating for in February this year. So they get together and they compile. All seniors of Georgia have an opportunity to send in information telling their representative what they want. So when we go to the Capitol, every individual from every county meets with their representatives and asks them to pass these bills.
Hold your point. You hit the nail right on the head. That's what I was trying to really find out. And you hit it right on the head, because you are so correct. In February, all of the people who the people voted for around the state of Georgia, and that's the people, state representative and senators, are in Atlanta for 3 months to put in place bills and support this and that. And just like you said, people who are part of this bill right now that the governor signed into law, that particular bill, like you said a few minutes ago, you can go in on that. So this group will be going in as a group and say to the representative, no matter whether you live in Brunswick, Darien, Richmond Hill, I don't care where, you still are part of the state. And you want to make sure that they support this bill. People in McIntosh County will be saying to their representative, we need your support with HR or whatever the bill, we need this. The people in Chatham County will be saying the same thing. People in Liberty County will be saying the same thing. So around the state, they will be saying the same thing on this particular bill, which is so needed to help everybody. Because as you age and this and that, you need that help. And these are the type of things that and so tonight we are talking about this particular bill. It's a lot of bills that they will be talking about in the next 3 months. I know, because I got a thing over there now with at least 300 or 400 different bills. And people will be lobbying as they go to Atlanta to talk about these things. And this is what we need. And you, the viewing audience, we will continue to make sure that from this show tonight, that we will get that information and provide it for you, that you will be able to call your representative and say, support this bill. We will find the numbers and what the bill is, and so you will know exactly. It might be HR 10 or HR 25, but we will make sure that we supply you with that information because everybody needs to put pressure on your representative, the people who represent you. And I just wanted to talk about that. Now, Wes, we can talk about that even some more.
I was just looking at this. It appears that according to this paper here, that there are significant cost savings when compared to in-home nursing care, beds and things. The first thing here, funding for in-home care, is 1/10 of what you don't pay for nursing home bills. Now, my question is that this is very important information for a lot of people. I did not know about this, and of course I'm a caregiver myself, so I'm reading this stuff very quickly now. But my wife is wheelchair bound, and so I'm looking at all this stuff here because it definitely costs us a lot of money if you try to go with a nursing home bill. But I would just want to ask you if you all could talk about it. So I might say, if it's safe to say that you made a question that there were offices in every county. So do we have one of these aging counties here in Georgia? I mean, it's Chatham County.
Have to have.
It has.
Yes.
No, it is.
It has to be.
It's the way it is. It got to be.
It got to be one.
Funding. There should be, and I'm quite sure it is.
Because I see it in the back here that they had a page for the Georgia Council on Aging.
Yeah, I have
Yeah,
one here too.
Georgia Council on
Georgia
Aging.
Council on Aging. And they got a 404 number here.
Right.
So I'm just very interested in this. I'm reading this myself for my own benefit right now. Thank you.
The seniors at McIntosh County Senior Center joined at Co-Age, and that's how we became to be members of Co-Age. I serve on Coastal Regional Commission Board, which is selected from the McIntosh County Commissioners Board, and I serve a 3-year term. I think my term will be up in 2020. This is not the first time I've been to the Capitol. Last year we went and we rallied for 5 or more bills. And one I'm going to mention is the abuse registry bill that we lobbied for, and it was passed before we left. I'm going to give you a little information on that. To all persons that serve in that capacity, family members, strangers, whoever is in your care, and you abuse that person, you will be prosecuted, and you will have a record that will follow you. So that is something to think about, a caregiver, being a caregiver. And truly, there's a lot of people out there that's being mistreated.
You are, both of y'all, you were so correct, because when I picked this up and you start looking at what all it does and the information on it, it's a lot of things, because right now for it's 95,000 Georgian are client. That just, they are client. It's a whole lot more beside those who are not client. It's seeking long-term care and stuff like that. So this is why you say it's so very important. And another thing is that why these things are so important, and because you have a lot of elected officials. I know them every day. I talk to them every day, a lot of them, that are unfamiliar with a lot of this stuff. You sit there sometime and you go to a particular bill and start talking about, well, what you talking about? What you mean what I'm talking about? You should be studying this thing and knowing what it's about, you know. But these are the type of things that you have to pry into the head of a person who represents you. And if they're not familiar with it, let them know, tell them something about it. And we need your support, not you as an individual, but people who you represent need your support. That's what we send you there for. This type of thing, and viewing audience. That's what we're talking about. We're talking about you as a whole. That when we get through with this thing, and we're gonna even talk about it some more to make sure that you get the support that you need, and making sure that you tell those individuals and to make sure that they support this particular bill. So we want to make sure that in these 3 months, at the end of March, when they get ready to leave, that budget is signed and put in place, that this bill is one of the ones that's on it, and they're supporting it 100%.
Let me just read something. I think it's very interesting.
Go right ahead, Wes.
Funding for in-home care. Staying as independent as possible for as long as possible is the top goal of Georgia's older population. Home and community-based services are designed to help achieve that independence when older adults want to remain in their homes. They may need help preparing meals, assistance with personal living tasks such as bathing, grocery shopping, and respiratory relief for their caregivers. These services cost the state less than 1/10 the cost of a Medicaid nursing home bed. Unfortunately, the waiting lists are long, and are too often seniors and their caregivers run out of options and turn to solutions that they do not want, and which cost taxpayers far more. So I thought that was very interesting. I want people to understand something here, because a lot of people go to nursing homes because they don't know about this service.
A lot of them go to nursing homes because they don't have caregivers, and there's got to be somebody to take care of them. So when they get in the nursing home, there's somebody to take care of them. And Medicaid and stuff helps with some of the stuff, but it doesn't do all of it.
No. And it can happen so quick. It's a lady who is a good friend of ours, the family. She is a faithful member of the Randolph Institute. She's a churchgoer. Miss Weston does help everybody in this community. You name it, she helps. And all of a sudden, my wife had told me she was in the hospital and she got sick. And just overnight, she's in the hospital. They relieved her from the hospital, and they got to take her to one of these right now. And right now, she's gonna have to have additional help, just like this. And just like I said, a month ago, she was doing everything, and now she's not. And that's why it's so important to support these kind of things and to make sure.
Yes, Chester, with the proper care, a lot of people could stay home and not go in these nursing homes.
Talk about that.
Because, if you got a caregiver and somebody that comes in to bathe and fix your food and stuff like that, you don't have to be in the nursing home. It's like I took care of my mother for 44 years. Right at home. But Medicaid did send someone in to help me. I had somebody come in for 4 hours because I was still working. And all this stuff helps, but we still need more funding for these things.
Definitely so.
Exactly. As we look at number 2, the ADRC funding, there's a number 1-866-552-4464, and they said, wouldn't it be great for Georgians to have a neutral source of information about options when they need help staying independent? So these are with the Aging and Disability Resources Connection. Families could get help for their loved ones. They can partner with organizations that are dedicated to providing accurate information, properly finance long-term supports and services. And then it went on to say the increase in older population ended up 2 federal grants have created a crisis in funding for the ADRC. Funding of $4 million will strengthen the ADRC statewide. So that's another capacity to meet the growing demand of critical information. So
And it's a lot of stuff out there, and a lot of people don't know about these things.
Wes, how about read the one down here, number 5, which health coverage for low income seniors.
When many residents of senior retirement communities point out the problem of high out-of-pocket health care costs for low-income Medicare beneficiaries, co-age members voted to help address this issue. The Qualified Medicare Beneficiaries QMB program assists beneficiaries with annual incomes below $12,384 with their Medicare premiums, deductible, and copays. A program serving seniors on Medicare with incomes slightly above that level to help with deductibles and copays could help improve health outcomes.
It just shows you that it's so much valuable information with this particular bill. And that's why when we first opened up, that I said the bill itself is Governor Deal signed the Family Care Act to help reduce the burden of family caregivers. And then it goes on from that, what the bill itself does and how it, and what we're talking about right now. And we want to make sure that they increase funding and other things it's a start here. But what needs to happen is that this particular bill, it needs more funding there because people right now, West, I think one thing he read, or one of you all, that who are on the wait list, waiting and what have you, and they don't have the room or finance or what have you to aid them at the particular time. But they have a certain, let's say dollars and cents. They might have something that we read earlier, that they might put a bill together and say, well, this bill will cover a percentage of people, let's just say 20% of the population of the state of Georgia. And if we talk about 20% of the population of the state of Georgia, you're talking about a whole lot of people. So stuff like that. And so we want to make sure that they tune this bill, they go back into it and do some more study and make sure that some of the people who represent us that introduce the bill or either make an amendment to this particular bill, don't introduce another bill because it's already there, but you amend that particular bill or put more funds there. And that's what needs to happen.
So where is your office actually located in McIntosh County? Is it located in a school or
it used to be the detention center off of Highway 251 in Darien.
The reason I was asking that because I was trying to think about where we could have, I'm sure we got one of these here in Chatham County.
I'm sure you do.
If, you can go to your Family and Children's Services and get more information also.
Well, I'm going to call this 444 number here.
Right.
Well, these are the 5 things that we're going to be
Lobbying
for this year for them to pass. These 5 items are the items that we're going to be lobbying for to make sure these bills get passed.
But you're telling me that you guys are going to be lobbying this in McIntosh County, right?
No, state.
You don't mean that, but you're going to be representing McIntosh County. So I want to find out where we represent Chatham County.
There are other ladies. There are other ladies coming to represent McIntosh County. There's a group of 23 of us that will board that bus and go. We will start picking up.
Viewing audience, we will be back in a few to continue the conversation to make sure that you don't be confused, that you get everything out of it that we are presenting to you tonight. Viewing audience, we are back and we want to continue explaining the information for you. And I want to explain in details how these districts are set up and who represent who. Now, state representative, and I'm going to read these to you all in Chatham County, where you would know. District 161, the guy name is Bill Hatchett. He represents people in Chatham County and Effingham. We have 162 is Gilliard. He represents individuals in Chatham County. You got 163, that district, Craig Gordon, he represents people in Chatham County. 164, you got Ron Stevens, who represent Bryan, Chatham, and Liberty. He represents a portion of all those little areas. Mickey Stevens, Chatham County. You got Jess Petrich. He is Bryan and Chatham County. And that's in this area. You got Glenn County. Now, we were just talking a few minutes ago, you all. Glenn County person is Jeff Jones. I know y'all probably know him. You should know him. He represents Glenn County, Long County, and McIntosh County. Al Williams represent Liberty County. Now, that's the county and that's those districts that those people are. But when they go back to lobby next week, a week after, whenever, when you all are there, you're going as a team talking about this bill and all of the other portion of that bill, what they are lobbying for. Now, when they talk to, they will know, in a sense, they should know, or they should know them, that I'm from McIntosh County, I'm from here, that he knows to make sure that that person go all out to support that bill. But you don't never stop talking to these other folks because you want all of them to support the bill. Because when they vote, all got to vote together. That bill, in order for it to pass, it got to be the majority of the House of Representatives. And so when they all come together as a team, they vote as a team. So but your representative who you pinpoint more, because that's the person who you vote for. And you tell that person, we need you to support this particular bill. We're going to check your record and we're going to check to see whether you support it or not. If you didn't support it, then we're not going to support you the next time around. These kind of things are what you have to deal with. And that's what you have to do on viewing audience, the same identical thing. To apply pressure on people who represent you. Now you're talking about senators. We were talking about Lester Jackson just a few minutes ago. Lester Jackson is a state senator. He still have a portion to play because the bill have to be passed by both houses, House of Representatives and the Senate.
That's right.
So when it get to the Senate side, he still needed to be to vote for it. You got 56, I think it's 56 senators in the state of Georgia and 180 some odd state representatives. So that's the way this thing is set up. So you need all of them to support these bills and familiarize them about these particular bills. They should themselves be familiar with them, but if they're not, you put the more pressure on them. But that's what you have to do on these particular bills. Now we have a young lady just came on with us, and would you let us know your name, hon?
I'm Margaret Ross. My pastor is Reverend Ernest L. Rouse, and we are at Shorter Chapel, AME Church in Bologna, Georgia. And I am
You said Bologna, Georgia?
Bologna.
Okay.
Right there, McIntosh Ministry.
All right, that's right.
I'm in the community of Bologna. And I have
Tell us, you on this team, tell us whatever you want to let us know about what y'all had been doing, what you have planned for the future, and all of these things. In your own way, whatever you want to tell us, the viewing audience.
to make sure that the seniors doesn't have to go into the nursing home, because I've had my mother in there for about 3, almost 4 years, and all because I had surgery and I couldn't handle her. But it's better that you can keep her at home than to put them in the nursing home, because when someone come in to care for them, you still have to check to make sure that things is going well and they're not being mistreated. Because sometimes they be mistreated and they won't tell you. And there's a lot of abuse going on, and that need to be stopped. And I think they really need to, persecute them for doing the things that they do, but they don't realize one day that they may get old and they may have to go to the nursing home or have somebody to come and take care of them, and they wouldn't want anybody to mistreat them that way.
That is very good. I'm glad you mentioned that, because my wife was just telling me the other day about some people that we know that's in some of these places, and how some nurses and some caregivers treat them so good. And then some, again, you get some bad ones.
Right.
And we want to weed those bad ones out, because and they need to, you don't know until they tell you.
Right.
But then after they tell you, then you can apply pressure to whoever it needs to be applied to. You don't go to the person who's doing this, but you find out who's over this facilities and this sort of thing, and make sure that something is done about it. Because we can't have people just treating people any kind of way, and they'll do it every day. I just want to let you know that. And I know a lot of you all know it yourself, because you witness these things. But anyway, you will know yourself.
And another thing, it's good to check your family members when they give them a bath or whatever. Take the clothes off and check their body for scars, bruises, or whatever, because sometimes they don't tell or they can't talk. And you need to make sure that's hygiene, proper, everything is taken care of, even if you have to stand there and watch sometimes to make sure.
I was just thinking about this. We went to the family reunion in Philadelphia this past summer, and one of the reasons we went was because my wife's aunts, she got 5 of them in their 90s, and the oldest one is 99. And while we were there, we noticed that they had a home care person taking care of them. And one of the things that one of the sisters said, it's important that we be here to make sure that they know when they put the kids in their bath, their food, and everything. But they seem so happy that they were all together at home. So there's a lot to their mental health has improved quite a bit. Well, let me ask, so the Governor Deal signed this Family Care Act, so we're lobbying for, we're lobbying for them to fund this, is that right?
Right. Make sure
The bill itself, and I know I have it over there in my stack of information, because if I knew I was going to be talking about it in detail, I would have got that information. The bill itself is over there. I got it in my stack in the budget, last year's budget. And you can look at it. I can go right to that particular, the Health Care Act bill, and look at it and see exactly how much money is allocated through the budget towards that. And you look at that and see what all it does and the amount of money that particular amount will support X number of individuals. And that's when you're talking about now applying more pressure to put more money into those areas to make sure that certain things are funded. I mean, it's so many things, and that's another thing that people need to understand. Please, you need to understand, if you are an average person and don't understand certain things about the political arena and how it works. And I'm saying it on the show and will continue to say it, because the facts will back up what I'm saying. I don't have it right in front of me, but the majority of the House of Representatives are Republican. The same thing on the Senate side. The majority are Republican. So what we are saying is, whether you're a Republican or Democrat, I don't care who you are, Your duties and responsibility is to help the people who send you there, to look out for them, to make sure money and certain things are there. See, a lot of conservative Republican, but a lot of people are there, and the facts will bear what I'm saying. I don't care if you're sitting up there and you voted on a particular bill and you turn around then and cut back and don't fund it. Well, we got a bill over there and we got this and that and everything. Look and see if the funds are there, because a lot of them will fund a lot of stuff that is not so important and don't fund something like this. So you got to stay on the top of them, because that's what's happening in these particular bills and a lot of things. And I think, but I don't know for sure whether Governor Deal did a jam-up job. I think he did pretty fair, but I don't, these things we'll have to look at. But what happened is that when I get that budget and you look at it, then you will see the amount of money spreading around and going to different things. And that's the taxpayers' money. That's not the people money. They are there to make sure that your dollars and cents are spent and go to the right places, because that's what you sent them there for. So don't jump up and down and say, I'm this and that. No, do what you're supposed to do. Then somebody will say, well, you're being a good representative. Somebody will give you the praise for that. But that's what have to happen, and but that's what's going on. I will be able to, even when we get, I don't know if I can find it, but anyway, it's there. And that's what y'all gonna be continued doing when you go up there to lobby on those particular things. Now, there'll be people spread all out over, lobbying for different things. Don't you know that this year past, we had an organization that was coming together, spread out throughout the state of Georgia, to try to get more Democrats elected in the state of Georgia this time around in the midterm election. Now, we didn't do that because we're in love with females or male or white or black or Democrat or Republican. We did that because the records show, and you can look at it for yourself, the records show that Democrats vote more for the underprivileged and all the people in need and all these other kind of things than the conservative Republican. The Republican vote more for corporation, big business, and a lot of other things. That's what you have to look at. It ain't in love with this person or the other person or one of those things. So what we did is we tried to even this thing up, to go around the state, to ask people to vote more in favor of Democrat. And we came out of that in statewide elections, where people hold position over committees or over this or that. We still don't have, whether you're white or black or Democrat, on the statewide. Right now, you can check them all out and you can read them all, and we still don't have a Democrat. And it's mind-boggling, because the rural areas where they need even more than urban and other places sometimes, and they turn around and vote for the enemy. Racism sometimes is cut us off at the path and cause us to don't vote for your own interests. And that's what happens. You look at healthcare, and you look at from Washington all the way back, and you're talking about even on the federal level, and talking about cutting Medicare and Medicaid, healthcare, hospital, all of these different things. Who in the world, the first hospitals and things they start closing down will be ones way out in the rural areas.
That's right.
Where a lot of working poor people have to go to, and they turn around and voting for somebody who's going to close the door on their hospital. And that's what's happening. That's what rural people don't study these things, and they do it. And they need to wise up. Need to wise up. Look at the national election just the other day in the midterm. We had a situation where the last 3 Senate seats came down to a runoff. And I know 2 of them because this show was involved, Grenshaw and I was involved with a runoff dealing with the state of Michigan and the state of Mississippi. Here's a situation where a conservative person who served as a Senate in Mississippi turn around, and farmers and all of these things are so crucial. And the facts were there that she could have voted, the people, they came close, but could have voted for somebody who would protect their interests. They turned around and voted for this person who is President Trump's personal friend. So to cut money away from farmers and all these other kind of things and hurt them, but dealing again with racism and this sort of stuff. And we need to wise up. We need to pay attention. In Michigan, we did all right. Now we had in Michigan again, we had a smart, intelligent African American guy who was a Republican. And it didn't matter whether he was Republican or Democrat. He was smart. He had all the things that he needed to have to represent people. But his views was conservative, big business, supporting President Trump and his issues and all these other kind of things. But he lost, and we're glad he lost. Now a lot of African American people who know him and was in that area did not support him. And that's what you're supposed to do. Whether a person white, black, or what have you, Republican or Democrat, if your record shows, and such their record that you're doing the right thing, then we should vote for them and put them in office. If it doesn't, we should just do the opposite. But that's what we need to do. I'm talking from some of these other folks.
One of the things that I just want to add to this is why it's so important that we be politically educated. We need to educate our people about the political situation, because it was good that the black people in Michigan decided not to support this guy. They thought they'd throw at a black guy and people would just go to him. But we need to educate people on things that you're talking about.
And we got a whipping in the state of Georgia. Here's a situation where white folks, Democrat and Republican, voted heavily in favor of Tracy April, because she was a good candidate. Voted in her favor heavily. We lost, but in a sense, it'll come out in the wash later. Because here's a person who was the Secretary of State. And the Secretary of State is in charge of elections and all of these other things. Correct. When he's decided he was going to run for governor, they should have removed him from there. White Republican, when they were running, should have made sure that they remove him. Democrat should have made sure that they remove him from there, but they didn't remove him the last minute, but they didn't remove him. So here's, like what you say, Wes, but the chicken guard the hen house door or some kind of thing.
Chester, I feel that we have nobody to blame but ourselves, because there are actually enough black people and brown people registered in the state of Georgia to have beat him if they don't come out. So the people are there. It's just that we do not seem to want to vote. The ladies come out in huge numbers. The brothers don't seem to be able to get it together. And I keep reminding people, we don't need to keep asking white people to help us across the line.
Right.
We got enough black people in Georgia and brown people in Georgia, even in the rural areas, to help us out. We just got to educate those folks and bring them along. It started that day. And sometimes, as I remember in the old days back in hometown, I can understand why some of those people do what they do, because I had to walk my mother and father to the polling place, and they were scared the whole time we were walking there. And so I had to walk them. So when you're out in the rural area and you work for somebody and you do this sort of thing, you don't think you have the right to do anything. My father said, son, I don't think we need to go vote with you. Yes, you do, Dad. And as I walked them up there and they walked into this one little grocery place, I realized just how frightened they were. Now, I was not, but they were. But so there are a lot of things out in the rural area that we have to educate our people, but we have to give them some sort of security too. So I can understand how people go out. They'll say, well, I'm not going to go. I remember my brother said, Wes, if we don't go with Mom and Dad, they're going to turn around and say, no, we're not going to walk with you. So there's a lot of fear, and a lot of people have things in their minds that we don't always notice, and we have to just be careful about that. But we need to educate them.
Right.
Well, just like you say, now, but this particular race was one that they stole, and they took it. And undercount votes, voter suppression, all these other kind of things in this particular race in the state of Georgia. Well, that ain't. They just stole the one next door, next state from us. That's the one that was in Florida. They took that one too. But we cannot just throw up our hands and say, well, they took it and we got to give up. We cannot give up. We can never give up. We got to continue. And eventually we'll come out victorious. We got to, they took 2 president elections from us in the state of Florida. All these things happen. But we still got to press on and continue to try to work to make sure that we don't give up.
But you know, Chester, the campaign that Stacey ran and the guy in Florida ran changed the demographics tremendously in both of those states. Yeah. People have found out that, it's sort of like when you throw a kid in the water that says swim, the kid doesn't believe they can swim. Right. They start learning that they can swim. A lot of people are beginning to believe that we possibly don't need other people to help us out. We can do a lot of things on our own. So it looks like we didn't win a whole lot, but we actually gained a lot. We gained a lot of confidence that we can get some things done, and we don't need everybody. We got black people who can get things done, but a lot of people still don't think that we can do that. But we gained a lot of information on those races, and I think that they're going to come back and help us out. And they're fighting the Republicans. Trust me. If you would listen to the Georgia Public Radio talk with Kemp and everybody, they are concerned about what the issues are going to be floating around, because they said Stacey Abrams has not ever given up on this whole thing. So now the fight is still on. Used to be, we could tell people, hey, you know what? We won the election, it's over now, and everybody walk away. No, Stacey, no, it's not over until I sing, and she hasn't sung yet.
Okay. No, it's not over. That's why in Georgia, things are not over. We got to continue fighting in rural areas or small places where we live. We got to keep pressing. We got to keep fighting to make sure that that what's due to us, we get it, we receive it. We'll finish up on this, and then we'll talk about it a little. We got a few more minutes, a little bit of national stuff. So before we tape off, all of you and her, tell the viewing audience in your own way and the people where you live and stuff, that they can, this show is going to be coming on, and they can pay attention to what you're saying and letting them know that and you all get some information to them so far they can call their representative and talking about this particular bill. I can tell you right now, the person who is Jeff Jones, and these are the people in Chatham County. Jeff Jones, he represents people in Glenn County, Long County, and McIntosh County. It's my county, McIntosh County. That's in the Brunswick area, but I want to let you know that if you want to put his phone number down, his phone number is, and that's in Atlanta. His phone number is 404-656-0177. Y'all can put that down too. That's your representative that you have. That's exactly right. That again is 404-656-0177. And he is in, that's the phone number he have in Atlanta. And so call him, that's in McIntosh County, and tell him to make sure that he support this particular bill. And you all can say what you want to do to the people about what you did tonight and this particular bill, how it affects and how it helps them. Y'all did a good job. Either one of y'all did.
I'm gonna end this with the 5 points that we'll be
Okay, very good.
rallying for. Number 1 is funding for in-home care, ADRC funding, which they are asking for $4 million to spread across the state. Number 3 is personal care home requirements. Those requirements are for individuals that are assisting elderly people. They may be related, they may not. But in the state of Georgia, the requirement is that you do not be a caregiver for, and I'm going to read it. Instead of saying it, I'm going to read it. A personal care home providing housing, food service, and one or more personal services for 2 or more adults who are not related to the owner or the administrator by blood or marriage. Georgia licensed over 1,400 personal care homes in Georgia for older and disabled Georgians. When these homes do not follow the law or the rules for providing services, residents are vulnerable. When threats to safety exist, the fines and sanctions that can be imposed are limited. In order to strengthen the compliance to better protect personal care home residents, Georgia needs to update their regulations. And that is a bill that is dear to my heart because I've seen individuals taking care of individuals and they're not being treated fairly.
And again, viewing audience, remember that what she just said. Now, this bill itself, that I'll guarantee is strengthening that $4 million, and these people have maybe did the depth study on this. So I guarantee the bill itself didn't have $4 million, but what they're looking at is going to take at least $4 million now to do a lot of things that they're trying to do. So make sure that you get them to push the bill itself, and especially those bills are breaking down if you look at them, and a portion of those bills, especially the part of that bill that's dealing with money, funding.
Okay, now looking at number 5 is when many residents of senior retired in the community point out problems of higher out-of-pocket costs, health care costs, and low-income medical benefit. Co-age member voted to help address this issue. The qualification of beneficiary of QMB program assists beneficiary with annual income below $12,384 with their Medicare premium deductible and copay. A program serving senior on Medicare with income slightly above the level of health with deductible copay could help improve health income. And
Okay. Thank you very much, and thank you all for being guests on the Dunham Report tonight. Viewing audience, we're going to be, because we wanted to do this portion for you to watch this. Next week we'll be back on with a lot of things dealing with the political arena. the political arena, especially a lot of history on that, on what's happening right now. So you have been watching the Dunham Report, where you, the community, come first, keeping a focus on the future. See you next week, but we want you to subscribe to our channel. Like us on Facebook, well, follow us on Instagram. See you next week. Good night.